Hi everyone. Welcome to the Community Mental Health Transformation monthly webinar. My name is Perce Williams. I'm Communications Officer at Sussex Partnership. I'm covering today for Megan, who's on annual leave at the moment. So I'm going to just be kind of like taking you through. And we've got our presenters today. We've got Penny Fenton, who's Community Pathway Lead at Sussex Partnership. And we've also got Andrea Potter, who's the VCSE Mental Health Lead in East Sussex and Brighton and Hove. So just before we make a start, I'm just going to take you through a little bit of housekeeping. So it's just a little reminder that we are recording the webinar today. We always record the webinars just so that we can share the link around with anybody who can't actually make it in person so that they can watch it back when they want. So it's just a little reminder that we are recording, and you've got the option if you want to keep your camera turned off, or you can turn your camera on. You can anonymise your name as well if that's helpful to you. So yeah, just wanted to let you know about that. Just going to let another couple of people in. There we go. We've also got live captions available that you can turn on. So if you just go down to the bottom of your screen, there's a button down the bottom that says more with 3 little dots. If you click on there, you can then select captions and turn that on if that's helpful for you. So we're going to go through the slides. Andrea and Penny are going to take us through the slides, and then at the end we're going to have about 15 minutes for questions and answers. So if you think of any questions that you want to ask during the session, you can put these in the Q&A chat box at the end, or raise your hand, and then we can go through them and Penny and Andrea can answer your questions at the end. We do have a short survey that we send around at the end of each of these webinars. So we'll email that round to you at the end with a copy of the recording of the webinar and a link to the survey. If you've got time, if you can let us know what you think about the survey, what you think about the webinar, how we can make it better, and if you've got any ideas of any themes that you might want us to cover in any future webinars, that'd be really helpful. So it's just sharing on the screen at the moment. There's a QR code there that takes you to our playlist on YouTube, and that shows all of the webinars that we've had so far. You can share that with your friends and family, and it's just a helpful way of keeping in touch and looking back at what we've covered so far. So if you've got a mobile phone, you can scan the QR code there. But we will share these slides again with you at the end of the webinar. So yeah, you don't need to do that right now. Okay, right, I'm going to hand over to Penny, who's going to take us through the first of the slides. Thank you, Penny.
Thank you. Just remembering to take myself off of mute, which is my usual trick. So, hi, yes, I'm Penny Fenton. I think as Per's introduced us, thank you. I work for Sussex or I'm employed by Sussex Partnership, but I work across the whole system. So with Andrea, my colleague today, and various other partners. So we're just going to talk a little bit, we're going to talk through about where we've got to and what's going to happen next. So I'll hand over to Andrea and we'll go back and forth. And as Per said, till the end when we can answer any questions people might have. If I can have the next slide, please. Thank you. So just to recap, and I'm sure most people on the call have heard this information before, so forgive me if you have. So the Community Mental Health Transformation is really joined in and connected in with the NHS long-term plan and the adoption of the Community Mental Health Framework for adults and older adults, which was the national framework agreed and led by NHS England, which really seeks to modernise community mental health services that haven't been modernised as a framework for many, many, many years, and also asking us to really specifically focus on people with more serious mental health needs, for want of a better term, and also include some specific pathways. So for people with eating disorders, complex emotional needs, and people with psychosis who may need some community rehabilitation. And really to start thinking about addressing the gaps between services so people feel like they have an experience of being supported or held by one team, that outcomes for those people, for people using services improve, and to simplify the way that services are delivered. So to make our services more accessible for people and less complex. So in doing so, as we outline on the slide here, we really want to think about offering people a holistic assessment and approach based on their individual needs, with a greater emphasis on psychological therapies and social and occupational interventions, including support as it outlines here, for employment, housing, debt, all of those areas that we know are determinants, can be predeterminants to challenging mental health. And really to think about how we come together. So people who've fed back to us for many, many times that they have to share their story quite frequently and in quite a repeated way. And people might have to currently access many, many assessments before they get to the right place. So we're really looking to support people to get to the right place, to the right skill set at the right time. And that's our end state ambition, to move towards that more effective and modernised way of working. Have the next slide, please. Oh, and the one after, thank you. So locally, for us to be able to do that, obviously we need to bring people together. And again, you may have seen this slide before, but it's been really important for us to really make sure we have all the partners around the table so we can really kind of put our money where our mouth is, so to speak, and really think about how we offer things and services as a whole system. So we have a partnership approach, and we have a governance system that now allows us to come together, think about what we want to deliver and how we're going to deliver it, and make decisions as a whole system. And as I say, this really chimes and aligns with the integrated care board. So the structuring way we are now planning and delivering services for people, it fits in with the national guidance, and it fits in with Sussex partnerships, local, or Sussex partnerships, I guess, internal, again, for want of a better term, ambitions around increasing partnership, working together more effectively across the whole system. And those governance structures are really key, and the things that we use and hold in mind when making any decisions or having any discussions are that we work towards the partnership, the principles, the 4 agreed principles that we've been co-producing with people throughout the last 3 years. And that's people want to experience personalised and complete care. They want their care to be simple and seamless. They want it to be accessible, inclusive, and they want it to be experienced as one team. Talk about that one team bit a little bit, as I do each time, in that we'll never get and shouldn't get every part of our system all working for one provider. It's not really about that. It's more about the experience. So when somebody steps forward and one of us says, oh, I need some help around my mental health, it feels like a team is coming and surrounding you, rather than you having to get from one team to the other, to the other, to the other, to try and find the help and support that you require at that moment in time. So those things are really important, and they're held at the heart of all of the programme as we work through what we're going to do and how we're going to deliver services. Over the next one, please. And in that vein, we've been working really and focusing on consultation and co-production. So there is a very small team that works on the kind of overarching model across Sussex. Myself and Andrea are a part of that team, but actually at the heart of that team is everyone. So we've spent a lot of time engaging with a range of stakeholders across all of Sussex, service users, expert experience staff, using both health and social care sector, families, carers. We're ever trying to expand that consultation and involvement of all of the different services, and we can talk a little bit more about that as we talk about the second phase that we're entering into a little bit later on. But in order to get to that first draft model, so the what are we going to do, and people may have seen this slide before, we've had lots and lots of different ways of presenting that draft model, including webinars, events, and 2 very specific and specialised webinars, which have been viewed, as it says there, nearly 400 times by a whole host of people. We've brought all the feedback together through all those various consultation events, and we've very recently in this month now taken that model and all of that information together to our mental health, learning disability and autism board, which is at the top of our governance structure, really to say, is this it? Have we got it right? And have we got your support to continue to do this? And we were really happy to report that, yes, that's been signed off, and that's kind of the last tick, so to speak, that will help us now really focus on local implementation. We've also been out in terms of to Sussex partnership folk, to many of the assessment and treatment teams, to see access facilitators. So they're the people that deliver physical health checks or support people to access physical health checks that are on GPs, SMI registers. And we've been out to speak to people like the Emotional Wellbeing Service and NHS talking therapies, and we continue to have those conversations So really trying to engage people that use our services and work within our services as much as we possibly can. And of course, making sure that lived experience is really, really present and really heard at place-based planning, delivery, mobilisation, as much as it has been in co-producing this model. That's been absolutely critical for us. And again, we continue to work on that. We work with the 3 groups that sit in East Sussex, West Sussex and Brighton and Hove, who are expert by experience groups that really coordinate some of that work. And we are soon to return to something called the scale meeting. People on the call might be already on it in May, at the end of May, I believe, to really have another conversation about co-production and making sure that we continue to co-produce in the best way we can within the resources we have. Myself and one of my colleagues also went out. We're frequently going out to GPs, but more recently we went out to a number of GPs through a webinar, and we had 107 GPs join the call. So that was really helpful to be able to continue to discuss and refine the model. So co-production continues to be really at the heart of everything we do, and consultation needs to really continue, and we will continue to do that. And as I say, we'll talk a bit about phase 2 and local implementation as we move from the what are we going to do to the how later on in the webinar. I could have the next slide. I believe I'm handing over to you now, Andrea.
Lovely. Yes. Thank you, Penny. Thanks for covering the background. And I'm going to cover now a bit more kind of what we're doing and what stage we're at now within the transformation programme. So as Penny said, I'm Andrea Potter and I'm the VCSE mental health lead for the transformation. So I work with Penny within the central team, ensuring that the VCSE are represented within the transformation that we're doing here in Sussex. And I'm also help to organise the VCSE mental health networks as well. So we bring voluntary organisations together across East Sussex and Brighton and Hove to ensure that they are kept up to date with what's happening with the transformation, also have an opportunity to be able to contribute, influence and really have a voice in transformation too. So I'm going to now talk to you today a bit more about kind of the progress that we've made so far, and also around kind of where we are in terms of phase 2 and the work that we're going to be doing at a local level. So if I could have the next slide, please, Piers. Thank you. So in terms of the transformation of community mental health services, what we've done is, it's a big task in transforming services across Sussex. We've broken them down into phases. And the different work that's going to take place within those phases. So we were in phase 1, and that was really concerned around the kind of programme initiation, the work that needed to take place to enable the programme to start, and also a kind of real design phase. So we're looking about kind of what we needed to design to be able to transform the services. And within that phase, there were sort of 2 real key tasks. The first one was around kind of creating mental health roles within primary care settings. And the second one was around kind of designing that new transform model for Sussex. So those tasks have now been completed, and we've designed a kind of new model, which we'll take you through shortly. And we have got kind of mental health roles now within primary care settings via our emotional wellbeing service. So we're kind of moving from that phase into phase 2, but just to kind of give you a bit of an overview of kind of some of the things that have now been achieved within phase 1. So in phase 1, as the emotional wellbeing service was set up and is now running, we now have that within 32 out of 39 primary care networks across Sussex. So that's in place now for people to be able to receive that support within GP settings. They can go to the GP and ask for mental health support and receive that. And sort of via having that in place in 32 out of the 39 PCNs, over 6,000 people now have received 2 or more contacts from that transformed service in the last 12 months. So more people are being able to be seen at kind of point of contact. We've also done some work within the community rehab services. So as Penny mentioned earlier, a kind of key focus within the transformation is looking at some of those sort of 3 specialist pathways, including community rehab, eating disorder services, and complex emotional needs. So within community rehab, we've now got services covering 29 out of 39 of the primary care networks across Sussex. And we've had over 400 people have had 2 or more contacts with the service over the last 12 months. We've also got the enhanced community rehab service expanded to cover kind of coastal West Sussex part. And we're also looking at plans to address the current gap within North West Sussex. And within community rehab, we've brought together and ensure we're having multi-agency triage meetings for routine referrals now. So bringing organisations together to look at the triage and look at what services are available to help support people. And another kind of achievement that we've been able to do over the last 12 months is the creation of the access facilitator role. So this is support for people with serious mental illness to ensure that they can get their physical health checks. So we know from data, people with SMIs, in terms of their physical health outcomes can be much lower. So making sure that we have that role in place to ensure that people are going in and are having their physical health checked by their GPs. And then in terms of other achievements within housing, we really understood the need to ensure that when we're trying to support people, we're thinking about them as a whole person and looking at all of their needs that might need addressing. So we've really tried to ensure that the housing strategy is embedded into our transformation programme so that people can, when they need support around the mental health, and people are also trying to understand what support they might need around their housing. So we've got housing support workers in community rehab teams, and also working into the assessment and treatment teams too. So trying to have a more holistic approach around addressing kind of all of a person's need when they need support too. So those are some of the successes that we've had within phase 1. And now we're just moving into phase 2. So if I could have the next slide, please. So phase 2 is now around the planning and the mobilisation of the new model that was designed within phase 1. So some of you may be familiar with this diagram. If not, I'm going to talk it through as well. But yeah, what we've done within phase 1 was design the new model. And the new model is called the Neighbourhood Mental Health Team Model. And on the right, you can see a visual representation of that model. So the idea is to really bring organisations together to work at a neighbourhood level to help support people. And it's really around those relationships of bringing services much more closely together so that when someone goes and receives support, they'll be able to receive support from a multitude of services working together as one team, as Penny mentioned earlier. And on the diagram, you can see that the support will be around kind of all the things that people might need help with. So right from the kind of first outside ring around when someone might just want some advice, some information, they might want some help or might want to point in the right direction of kind of some self-help resources, through to when somebody might need actual support and want to see somebody. And there's different organisations and support services that might exist within that, through to kind of when people need more intensive support as well, or crisis support or emergency support. So the kind of different layers of support that people might need and might need to experience, and those might not necessarily be in isolation, they might be together, but bringing that together under a neighbourhood mental health team that will operate locally to help support somebody and the range of support needs that they might have. And the idea is that within the neighbourhood team, there'll be a kind of core team, and that will bring together and integrate the kind of VCSE emotional wellbeing service with the ATS, which is the assessment and treatment service, and include specialist older adult mental health services too, and those access facilitators that I mentioned earlier as a kind of core team. And the core team will ensure that there's triage for people, and again looking at doing that in a multidisciplinary way to ensure that person's whole needs are assessed and people are able to receive support much more quickly and in parallel. So they might be able to receive some support from VCSE, they might be able to receive some support around their housing, all at the same time, rather than being ping-ponged back and forward between different services, the delays that might take place there, the duplication that might take place there. Someone will be able to move much more seamlessly between services and receive support in parallel, rather than having to kind of wait long periods of time. And again, that will improve kind of communication between the referrers and the teams, and allow someone to receive a better quality of experience as well. And this would include, obviously, as I mentioned, the NHS, VCSE, local authorities, GPs, primary care, different partners working together as a neighbourhood to help support somebody. And it will really include a real broad mix of different skills as well. So we're thinking about including, you know, peer support, social prescribing, VCSE. And in terms of the roles that could include, the detail of that's still being decided, but, you know, it could include roles such as a kind of system navigator, social prescribers, and key working to help somebody move much more seamlessly through that new support model. So if I could have the next slide, please, Piers. So in terms of how that neighbourhood team will be made up and kind of what that looks like in terms of its structure, as mentioned before, the neighbourhood team will have a kind of core team within it, but it'll also have those aligned services, those other services that will be able to provide support to someone much more widely than just mental health, and also a kind of wider network. So thinking about the different social assets that are in place already within the community, bringing those in to give people much better access to those, thinking about the voluntary organisations that already exist as well, and ensuring that we kind of bring things much more closely together so people can get support much more quickly and much more easily. And kind of in terms of how the neighbourhood teams will operate, they'll obviously work in terms of those sort of shared principles that we mentioned earlier on in the presentation. And it's really about partnership working, so bringing people together to work together much more closely and build those relationships, about understanding, you know, what offers exist and how we can get support to people and ensure that they're able to access those. And also about kind of bringing people together to really consider someone as a whole person and what might be good for people to be able to get access to. And it's also to avoid duplication. So yeah, really bringing people together to enable that much more smooth transition between the different support offers that exist. And in terms of the sort of function and the responsibility of the team, it's to ensure that via working together in a new way, we are ensuring that people have a much more personalised offer and access to much more evidence-based treatment, that it is easier for people to access as well. So people knowing that when they can go to one place, the neighbourhood team, and be able to access a whole range of services much more easily, and also much easier to understand of where to go as a kind of first point of contact as well. As I mentioned, it's enabling that multi-agency working, at triage, at consultation, in terms of interventions and shared care. It will also kind of enable us to increase the uptake of those evidence-based interventions as well. So smoother access for people and being able to transfer people much more easily in terms of the support that they might need. And then in terms of that kind of whole person offer and more holistic support, it's making sure that people have access to support around housing, debt, employment, all the determinants around that influence someone's mental health as well, or could be a support need that they have when they are unwell, making sure that there's much easier access to that. And also we want to be much more responsive to people's needs. So rather than, you know, people being ineligible to services, it's around bringing people in. There's no wrong front door. It's around, okay, what are your needs and how can we meet them, rather than don't qualify, you're not eligible for the support. It's thinking about what needs we can provide as well. So that's the kind of ethos behind it, and the kind of principles and ways that we want to work as a new neighbourhood team. So under kind of phase 2, it's now around moving from that kind of central development and that co-produced development of the new model now to a kind of place-based planning and mobilisation of these new teams. So as Penny mentioned, we have the East Sussex, Brighton and Hove and West Sussex place-based teams who are now going to be leading on developing and mobilising these teams at a local level. So if I could have the next slide, please, Piers. Oh, and I think before we go into kind of the place-based mobilisation officer, I'm going to hand back to Penny just to talk about the older person's offer within that new neighbourhood team as well.
Thank you, Andrea. We've added this slide more recently to just really emphasise that it's an ageless model, and to make sure that our older people's services are as included and considered as each age in adulthood. We've also got a similar piece of work happening for people in that transition age, 16 to 25, but this particular slide is really important to really demonstrate that SOAMs will operate in the same way. So we won't, of course, get rid of the skill set and the offer around SOAMs, around older adult mental health services, because they're absolutely critical, particularly in East and West Sussex and actually everywhere across the country, about the growth rate for this particular population. So that growth rate of people over 65 is large over coming years. So to make sure we still have it, but also to make sure we are supporting the older adult services to be able to be part of that modernisation. So on each bit of the circles that you saw in the diagram, making sure there is an age appropriate offer across all of those bits of the ring. So people wanting to get in support, advice and guidance, right through to people needing perhaps much more specialist work. I'm recognising that across partnerships, some of those partnerships change as we work with different populations. So for older adults, as this outlines, not all of the relationships will be the same. So we'll be working with different partners and perhaps people we're not used to working with so closely or in the same way that we do within the adult services. So just really wanted to highlight that we have two people that work within our core team and offer some time to that core team to really make sure we're capturing the work around older adults within the neighbourhood mental health teams. Thank you. Can I have the next slide, please? And this really just outlines the things that we've talked about before, why we might be doing this, the impacts that we really want to start to see. And fundamentally, we want to see people having a better experience, an improved experience, and for our system to work much more effectively. And in these days of perhaps challenging finances and all of those things, really making sure we make the absolute most of every single bit of resource that we have. For our staff, we want to make sure they're really clear on their job roles, because that's been a bit challenging over the years as teams have developed and roles have changed in the community. And we want to make sure that people feel really confident that they can access our services and that more people can access those services, a bit as we outlined with the emotional wellbeing services developments. But we'd like to see that across the whole pathway. So we're really focusing now on bringing all of those aspects of our current model together to really work on this more holistic offer. If I can have the next slide, please. And the one after, thank you. So really, as Andrea has described and that we talked about, we're now moving into this phase 2 of delivery. So we've described the what, and we've consulted and co-produced widely on the what, and we're really now thinking about the detail of the how. And of course, this is a challenging but exciting phase, because we're really now not just working at place, so with East Sussex, West Sussex and Brighton and Hove, but those places, understanding what each of their teams will look like within that place, because obviously each of those areas are big, and there'll be a number of mental health teams that sit under West Sussex, East Sussex and Brighton and Hove. So there's much more involvement, and the names of the groups that are working in those areas have now changed, and rightly so, to focus and reflect the fact that we're moving into local planning and delivery. The system, the Integrated Care Board, have asked that we really try and move at pace, as much pace as possible, really start to commence seeing those changes by October 24, with a complete rollout by March 25. Really ambitious targets, but we should be ambitious and work towards those in the best way that we can. So in order to do that, we had to think about milestones for this phase of the project. And things that were really important were to make sure we had those local governance and mobilisation plans developed and agreed for each area. So really going back to thinking about us coming together as a whole system in the first slides about our governance, also making sure there's governance sitting underneath at a local area. And that's really critical, of course, to make sure we're delivering co-produced, safe and effective services. And we've got that buy-in and recognition of what's happening in each area at the forefront of our minds. And to really now get into the detail of how many footprints should we have in each area, what will they be called, what will they reflect in terms of the rest of the system. So we have groups of GPs working together called primary care networks as a cluster. We have another set of innovation happening called integrated care teams, which are more around acute and physical health. And how do we actually bring all these things together so we're not duplicating and confusing ourselves in the context of the rest of the system? So we're working together again with all of our partners locally to really understand what will work best in each area. So the footprints will be undoubtedly different in the 3 localities, but the principles will be the same. There's been a lot of work on the function and the services and the team makeup. and that work continues. So we have quite a big document that describes in more detail the function that sits along slide decks like this. But the detail of that and who should be in and which team should really start should be our starting point. And the reason that's not uniform is because we're not starting from the same place. So in East Sussex, West Sussex and Brighton and Hove, there were already different teams. So we're not starting from the same start line, so to speak. So even more critical, this is done locally. The operational leadership, of course, becomes even more key. So we're talking about, you know, the people delivering services, leading the delivery of those local services, really getting involved at this point, really understanding how things might be able to work, really leading some of those ways, and really using our amazing expertise across the whole system in doing work like this to really reflect local population needs. And then, of course, we need to move to mobilisation and then get ourselves up and fully functional. Really important point to mention in the delivery, there's been a lot of work done around population health, really, really critical and key to help us reflect the differences in each of our populations and what things we might need to tweak in each locality to make sure we're addressing those local population needs and we're outreaching in a different way to communities that we haven't managed to build those relationships with in the most effective way in the past. So that stuff's really exciting. So West Sussex just finished their Joint Strategic Needs Assessment, and that's starting to be utilised, and how can we use it, and the other areas have something similar. So it's really exciting to be able to really use the information we've got about populations to start to address needs at a local level. We really need to have those place-based leadership groups in place, and each of those areas, East Sussex, West Sussex and Brighton and Hove, are working on their local governance structure to make sure that happens. And we really need buy-in, because fundamentally the change for us, of course, there's a lot of process change, but ultimately it's relational. We have to really work out how we work with each other across all of our agencies across the system. And that's the real excitement and the real chance for innovation and change, and reducing duplication and smoothing out those pathways. So just by starting to bring all those organisations together at a local level, those conversations are already starting to happen. So it's really exciting as we progress. We'll need to do more and more of that. And then, of course, the central team that Andrea and I are part of will need to continue to really carry on doing our best to support clinical and operational local leaders to co-develop those plans and make sure we've got this golden thread, and make sure we don't move away from the agreed co-produced model that we'd worked hard on over the last few years with all of our partners and people that use services and work within them to make sure that stays at the heart of the things that we're doing. So we're moving to a really exciting phase, but a really busy phase for everybody. So we're really just working that out at the moment. And in future webinars, we were considering whether we need to now think about presenting those area plans at a more focused webinar for each of the 3 areas, and we can come back and think about that a little bit more as we continue. So exciting times. We know the what, we've got the agreement of the model, just to summarize, and now we're really getting into the nitty-gritty and the detail of the how. Thank you. If I could have the next slide. So that's where we are now, of course, open to questions at this point. And this slide really is just to make sure people do feel joined in and they do feel they're connected and able to become involved. So please, please, please share this far and wide with as many colleagues as you can and anywhere you can. We really welcome that involvement. And at this point, if you've got local contacts in East Sussex, West Sussex and Brighton and Hove, wherever you work, please, please, please get in touch with your local planning group. And that will be required more and more and more as we move towards, as I say, the detail and the setup and the nitty-gritty of really getting ourselves moving forward. One of our first tasks is really to start to pull all of the developments that we've got together in a tighter way to really start the ball rolling. And hopefully we will soon have our neighbourhood footprints, perhaps for the next webinar. That would be exciting, wouldn't it? So I'll finish there. I'm not sure, Andrew, if you've got anything else you want to add before we go to any questions.
No, that's really helpful. Thank you, Penny. I think as well, just to add that in addition to the sort of the model design now being signed off, we have got some resources as well to help support you. The Megan from the comms team has put together some frequently asked questions as well that can be accessed via the link, I think on number 5, which is really helpful. Kind of some of those questions that we get asked quite often around kind of what will happen within the transformation program, what it might mean to you as well. So they're a really useful resource, and a really useful resource that you can sort of share with other team members or your organisation as well. So yeah, definitely recommend having a look at those. And I think, as Penny said, that now's really the opportunity if you want to get involved at a local level as those kind of plans are being developed and that details being developed in terms of the footprints for the new teams, what those new teams will look like, what services will be in those teams. That detail is now kind of really going to be decided. So it's a really great opportunity to kind of be involved within that work. And we can give you details of kind of who to contact in your local area as well if you're interested in doing that.
Thank you, Andrew and Penny. That was a really good presentation. So much has happened since the last time I supported one of these webinars. The last time I was here, we were just looking at the graphic that was going to explain the neighbourhood team. So it's really good to come back and see how far we've come with everything, and that we're kind of like moving into the delivery phase. It's really good work and really lots of detail in the presentation. So thank you. I'm just going to have a look, see if we've got any questions in the chat. Couldn't see anything earlier. So let's just have a quick look. I can't see any questions in there. See if anyone's got their hand up. No, I think we've gone into so much detail. That there aren't any questions. I'm going to stop sharing just for a second, just so that I can make sure that I'm checking the chat okay. Yeah, no, I can't see any questions in there. So yeah, I just wanted to say thank you to everyone for coming along and for coming to the webinar. And thank you to Penny and Andrea for taking us through the slides. There was so much detail there, and like I said, it's really good to hear how far along the program's coming. Some amazing work that's being done there. I can't see that there are any questions, so I think we can probably bring the, oh, somebody just said thank you for the very useful information, which is really lovely. Yeah, I can't see any questions in there, so I think we might be able to bring the webinar to a close. But yeah, thank you to everybody for coming along, and thank you to Penny and to Andrea again. The next webinar is on the 19th of June. Megan will be back for that one. So I'll just say goodbye for now, and yeah, thanks everybody. See you later.
Thank you.
Thank you. Bye.
Thank you, everyone. Bye-bye.